Asthma, we call it chronic obstructive airway disease. This is a disease where you cannot breathe well. When you are breathing, and most of us when you're breathing, you're not aware. But when you've got asthma, you force breathing in and you force breathing out because the tracheas, the bronchioles, they are constricted or they have narrowed. And then when they are normal, the air passes without a problem. But when there's a problem, there's a constriction, there's a limitation of the air coming in and limitation of air coming out. So somebody has to force it, and that's why somebody has got a wheezing. Asthma is not infective. Asthma is an allergic condition. So the allergies or the allergens, they just increase during the cold season. That is June, July, and August. And that's when the people have got asthma now. Asthma is a chronic disease. You normally have it anytime. And asthma, you are allergic, or the allergen can be the smoke, can be dust, can be perfume, can be anything. So it's normally very difficult for somebody who has asthma to know what am I allergic to. And you find that somebody was allergic to smoke. Smoke is almost everywhere. Dust is everywhere. So you can get attacks of asthma at this given time. So what we need to do for those who have got allergy for asthmatic attacks, they increase at this time. When they come, it's good to have inhaler. First, long time we used to give them drugs all the time called Frano, but nowadays inhalers are quite effective, and when taking inhaler be effective. So what you need to do is just take an inhaler when you've got attack, and when it progresses, just come to hospital, because it's not good to stay with asthmatic attack at home for a long time. For 6 hours, that's too long. At least 1 hour, 2 hours, and then you come to hospital also. That could be assisted, because there are some things which we do to somebody who has got asthmatic attacks, because asthmatic attacks are normally quite serious. So what you need to do is focus on your respiration, to focus on your cough, focus on your nose. And I know there are people who have got chronic sinusitis, they've got pain in forehead, and their voices have changed, and they produce a lot of thick mucus that they need also to be treated. So that's exactly what we do, and for this month, and that's what the disease I need to discuss about, because of the disease which are quite serious for us at this time. The only thing is that I've said that if you want to reduce the attacks or the pneumonias, the flus, and the rest of infections this time for the children and adults, you just need to increase intake of vitamin B, vitamin C, omega-3s, that fish oils, and those could prevent. And for us as a hospital, apart from treatment with antibiotics, of course, when you've got pneumonia, you treat you with antibiotics, we normally give you supplements. And you've got so many supplements which you assist people who have got asthma, people who have got sinusitis, people who have got chronic obstructive airway disease, and mainly we normally give them depending on what we're suffering from. And normally when we give, especially for people who have got asthma and asthma chronic disease, when we give our supplements, within 3 months or 6 months, that asthma goes for good. And remember, there is no treatment for asthma. We just control it when it comes. But for the supplements which you give, not drugs, it's supplements, because it's something missing in your system. And most of the substances missing in your system when you got asthma is mainly fish oil and vitamin C. Once you give you fish oil and vitamin C, you are good to go. The asthma will be able to go, and you not have asthma at all, attack, and you stop you using the inhalers or Franos if you're still using the Frano. So what is very important is that, and what you can do as a family or as individuals, that just get in touch with us and to be able to make sure that at least you get the right treatment first, and the last supplement, which are also very important. Now, I've talked about supplement, and to finish, and because also this is very important, we have got supplement for all the diseases, not the treatment. The treatment you can be given by any doctor. You can visit any doctor and give the treatment. But for us as a hospital, and more so as myself, I normally focus on supplement. We have a supplement for people who have got diabetes. The supplement come and see us, will give you a supplement for diabetes, so that your diabetes not become serious. We have supplement for people with hypertension. We have got supplement for people who have got abdominal problems, abdominal distension, gas, constipation. We have got very good supplement who can assist you. We got supplement for people who have got issues of their infertility or their fertility, both in men and women. We have got also supplement for people who have got arthritis. In fact, for arthritis, we normally do the treatment. So it's normally very important to make sure that at least for those people who have got issues, got chronic diseases, apart from treatment, which you can go to any hospital, to any doctor, when you approach us, you will be able to deal with that disease, and that disease can go away, because most of the diseases which you're having nowadays, we have the diseases because we are lacking something in our body. We are lacking something in the body. We want to supplement. We want to add something. We want to make sure that something is in adequate amounts. And my experience, and for most of the time, especially for the last maybe 5 years, I've seen that actually my patients do well with the supplement more than the drugs. Of course, I'm a doctor, and I know drugs are very good and they're needed. But what I've discovered, and this is actually a surprise for me, because most patients, when you give the supplement, they do well and they stop using the drugs. I'm talking about chronic diseases. I'm talking about arthritis. I'm talking about hypertension. I'm talking about diabetes. I'm talking about asthmas. I'm talking about gastric pain, constipation. We want to give you the treatment, and when it goes almost for good. And the same thing with infertility, especially for people who have never had children at all. People, just because they don't have hormones, men have issues of their low libido, which is quite a major problem, which I've discovered recently is a major problem. And all the patients, all the clients, of course, they're not sick, because arthritis, of course, that is a sickness, but infertility is not sickness. But if I give you the correct supplements in your body, you become okay. And that's when normally what we are doing nowadays. And it's very important. Just contact us. And this, I want to give you my number. You can call me anytime. And before I give you my number, remember that we are in the Zambezi Hospital and we are in South Sea, and we are open 24 hours. We are both inpatient and outpatient. If you want to come and see us, is come see us. If you want to see us in Nairobi, South Sea, my main road. If you want to see us in Mombasa, we are normally in Umbrella House, floor 8. And when you want to see me, I'm there in every Thursdays, floor 8. But the rest of the days, you can go there and be checked. And in case you need supplement, you'll be able to be given a supplement by my people. So my number is 0722 801 299. 0722 801 299. That's my number, which is in Safaricom. And the other number is in Airtel, 0734 801 299. That's my number in Airtel. You can call me, you can send me a SMS. For those who want to join us in our WhatsApp groups, they can use the Safaricom number, which is we use for WhatsApp group. Thank you.